You're watching DD India News Hour. I'm Mark Lynn. Now, India's healthcare sector has undergone significant transformation, marked by advancements in infrastructure, technology and accessibility. This journey towards enhancing public health has been propelled by, focused efforts to meet the Sustainable Development Goals and also a commitment to bolstering the healthcare infrastructure of India. Let's look at this report.
In a significant move, Prime Minister Narendra Modi has extended the Ayushman Bharat scheme to senior citizens aged 70 years and above, effective from October 29, 2024. This extension aims to provide comprehensive healthcare support to senior citizens, ensuring they receive necessary medical care without financial burden. With this expansion, senior citizens will receive individual health coverage of up to 500,000 rupees per year, separate from the family's existing coverage. The coverage is for their lifetime, ensuring continuous access to healthcare services. There is no income limit for eligibility, making it accessible to all senior citizens. Every elderly person above 70 years of age will get free treatment through the Ayushman Vaya Vandana card, significantly reducing out-of-pocket expenditure. Senior citizens already covered under other public health insurance schemes can choose to continue with their existing scheme or opt for Ayushman Bharat. Those with private health insurance can also benefit from the scheme. However, the scheme has not been implemented in Delhi and West Bengal. PM Modi affirmed that no poor child's dream of becoming a doctor would be shattered and no middle-class student would be forced to study abroad due to lack of options in India. Nearly 100,000 new MBBS and MD seats have been added over the past 10 years, with another 75,000 seats to be added in the next 5 years. The Prime Minister also laid the foundation stone of 5 nursing colleges in Shivpuri, Ratlam, Khandwa, Rajgarh and Mandsaur in Madhya Pradesh, 21 critical care blocks in Himachal Pradesh, Karnataka, Manipur, Tamil Nadu and Rajasthan under the Ayushman Bharat Health Infrastructure Mission, and several facilities and service extensions at AIIMS in New Delhi and AIIMS Bilaspur, Himachal Pradesh. These projects will bring healthcare benefits to around 5.5 million ESI beneficiaries. The Prime Minister has been a strong proponent of expanding the usage of technology to enhance service delivery across sectors. In an innovative usage of drone technology to make healthcare more accessible, the Prime Minister launched drone services at 11 tertiary healthcare institutions. The Ayushman Bharat Health Infrastructure Mission has an outlay of around $8 billion over the 6 years, aiming to strengthen health systems at all levels of primary, secondary, and tertiary care. This includes establishing 17,788 rural and 11,024 urban health and wellness centers, setting up 3,382 block public health units, establishing health labs in all districts, building critical care hospital blocks in districts with populations over 500,000, and launching helicopter emergency services and drone-based healthcare delivery. The Prime Minister also launched a nationwide campaign, Desh Ka Prakriti Parikshan Abhiyan, aiming to raise health awareness among citizens. He also launched the state-specific action plan on climate change and human health for each state and UT, which will lay out adaptation strategies towards developing climate-resilient healthcare services. Bureau Report, DD India.
And we are privileged to have with us Professor V.K. Paul, Member Health at Niti Aayog. Thank you very much, Dr. Paul, for being with us. So let's start with the aspect of extending Ayushman Bharat to the people, for senior citizens above 70. Affordability is obviously key. But how do you view this prioritizing also from a socio-economic point of view?
Well, today has been an auspicious day and a historic day in the history of India for the health sector. Comprehensive infrastructure projects, as have been covered in the film, have been launched or initiated. But it's very special for the senior citizens of India today. Today is incidentally the celebration in the name of Lord Dhanvantri, who is the mythological god of health and well-being and welfare and prosperity. The Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, the health assurance scheme, mega scheme, the world's biggest scheme, of its kind, already has been covering, as you said, 550 million people and providing half a million rupee coverage for the family. But now to this has been added the coverage for senior citizens above the age of 70 years, all of them.
Right.
The existing scheme covers the bottom 40% individuals. It doesn't cover everybody, but it covers the most needy, the most vulnerable, and serving very effectively. But now for senior citizens, it is universal. It means irrespective, regardless of the socio-economic status, regardless of income, everybody is going to be covered in this scheme.
Right.
And the coverage is ₹500,000 rupees. It's a coverage per family, so it's going to benefit 45 million families,
Right.
and 60 million senior citizens of this age.
The question that comes to mind, Dr. Paul, is that healthcare, of course, could be a huge challenge for a country like India, the size of India, and we can see that this is already the largest scheme. To what extent has infrastructure matched the demand over the last 10 years?
Well, these last 10 years have been remarkable in increasing the infrastructure for our nation. Let me take one example, infrastructure at the primary healthcare levels. As was also mentioned in the report, India is transforming its primary healthcare system by upgrading and making it optimally functional. The health and wellness center, we call them Ayushman Arogya Mandirs.
Yes.
These are more than 175,000 in numbers in rural areas and urban areas. And a typical Ayushman Arogya Mandir covers about 6,000 population. So for that population, very finite size population, there is a new worker, a trained nurse, whom we call now community health officer. 140,000 of them have been deployed in the last 5 years. So a real push for primary healthcare infrastructure, and this would provide free drugs to the tune of as many as more than 100, and in the larger ones more than 170 drugs. Right. Diagnostics in the small subcenter, Ayushman Arogya Mandir is 14, and 42 if it is primary health center, the bigger Ayushman Arogya Mandirs. It will also be a hub for screening. It will provide primary health care through 12 comprehensive packages. So taking infrastructure and services closest to the people. This is one example. The other example of infrastructure strengthening is what you heard partly on the film. We have built from 6 new AIMSs, right. 22 AIMSs are right. now in place in these 10 years. You heard about critical care units in all districts and in medical colleges. Critical care units are right. being established. Intensive care units for pediatric care are being established. Sure. Then you heard about our pandemic preparedness, within which more than 3,000 block primary healthcare units and laboratories will be established. All the districts will have integrated public health unit. From one National Center for Disease Control, the NCDC, which is like the CDC of the USA, we are going to have 5 branches, 30 branches, 5 regional centers, yes. and they will be in position. From single National Institute of Virology, they are going to be 4 additional virology. Sure. BSL lab 4, we have 1, it's going to be 4, and so on. It takes time to explain it. And today, it's going further with the employees scheme, employees social insurance scheme, yes. augmenting its services. You heard about new nursing colleges and so right. on. Absolutely. It's a great day for the
healthcare sector.
Indeed, definitely. For the entire healthcare sector, particularly for the health protection.
Today is also Ayurveda Day.
Indeed.
And we look at the growth of alternative medicine in India, Ayush, and how does it complement allopathy? Because it's being celebrated also in 150 countries across Indeed. The world. And how does it help us also in this Ayushman Bharat mission?
It's clearly the policy of the government that the care is to be provided in an integrative way, in a holistic way. And our traditional medicine, curated over thousands of years, more than 3,000, right. 4,000 years, is a heritage, but also a huge resource and a repository and a base for providing healthcare accepted by people. So in the course of these 10 years under the leadership of the Prime Minister, Ayurveda and Siddha and Unani and homeopathy and Sovarikpa, all these paddhatis of Indian origin and traditional system have found their place. They are visible, their presence has increased globally within the country, and today we had the second phase of the All India Institute of Ayurveda being launched and 5 other centers being launched and so on and so forth. Our Ayurveda related exports have moved from $3 billion to $24 billion.
Huge jump.
So it's really huge, and it is. I mean, for us, it is a mainstream system which works in conjunction with the modern system for the benefit of the people. We also have the Global Center for Traditional Medicine coming up in Jamnagar, so there is a huge way forward. And today, one very important initiative has been launched. It's the campaign for public health, in which the classification of individuals based on Ayurveda principles, Prakriti, will be ascertained. So you will be guided as to you belong to this kind of phenotype. You are prone to these kinds of diseases based on the Prakriti, and then guidance for prevention and for further care will be given.
So we've been talking at length about the Ayushman Bharat program. To what extent can it be emulated by other countries of the global south, and how best are we sharing our best practices?
Well, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, the health assurance scheme, the principles can be owned up and applied in other societies. What are the principles? Principles are that for the vulnerable, the responsibility for providing care without health shocks and health stress and out-of-pocket expenditure has to be borne by the public sector, by the government, from the taxpayer. That's our model. Number 2, its principle is bring private sector and government sector together into one sector. But by having PMJ purchasing capabilities from the private sector as well as government sector, you bring it together. Third, the digital backbone of PMJ. Actually, they can just pick out this one from India, which is cashless and it is transparent, it's visible, and it is so effective because it's based on a very, very robust India-made, And lastly, I would say it also imbibes the principle of federalism because we work together with the state government. So these 4 principles are indeed universal.
A final question, Dr. Paul. Indian doctors have excelled across the world, especially after all the training that they get here in India in the OPDs. So is there a concern that we have now 100,000 more seats for doctors, 75,000 more to be added, that doctors will be emigrating? Or do you look at this as India's soft power growing?
Firstly, we should look upon this creation of seats and manpower, human resource pipeline to start with for India. We need more doctors. We are currently, including Ayush, are 1.4 per 1,000. Developed nations typically have 2.5 to 3 per 1,000. So we have a journey to go to almost double, but clearly, as per the national health policy, go to 2 per 1,000, and therefore we can add doctors and make sure that they move to the tier 2 system and beyond and are available to provide care. For those additional pathways have to be done, but only when you can do that only when there are doctors, and that's changing now, and indeed it is making a difference. Number 2, yes indeed, and why not? As we have supply which is more than what India needs, there are opportunities outside. Even today, more than 60,000 doctors in the UK system are Indian, and more than 90,000 in USA.
Absolutely.
And sure, there is a market out there, and भारत के doctors जो है वो मानवता के लिए है, तो उस context में ये सही है. लेकिन I'll just wrap up to say that being a special day, the Honorable Prime Minister said today that Viksit Bharat 2047 is not our goal. A developed nation is, of course, the goal, but we also envision a Niramaya Bharat, which means an India which is free of ailments,
Right.
free of disease. It's a very special day
wonderful
and special
concept,
tribute
yes.
to the senior citizens who need it most, who often have morbidities, more than one disease and so on, maybe stressed financially, living alone, and a lot of them are women. In the elderly population, there are more women than men. So it's a real tribute to the people
Yes.
of India. This initiative will go a very long way in wiping the tears of a lot of people and give better health.
We leave it there. Thank you very much, Dr. V.K. Paul, member Niti Aayog. Thank you for enlightening us on the finer aspects of the Ayushman Bharat scheme.